Hi, my name is Rod Plunkett. I'm a doctor of physical therapy and a certified athletic trainer. Today we're going to go over care for a sprained ankle and the steps to follow. As always, consult your physician first to make sure it's not too severe for you to follow the steps we're about to go over. This is phase 1 of the injury care guidelines, the price section, and there is a PDF of this you can download to follow along as you go through this example. This is Jenna. She's an area volleyball player and a very good one, and she sprained her ankle. So she's come to us with a lateral ankle sprain, and we're going to go through phase 1 of the recovery program, and that's going to be protection, rest, ice, compression, and elevation. The protection phase is to fit her today with an active ankle brace to decrease her activity and to protect her when she's weight bearing again and as she's recovering. The rest portion is to decrease her activity level, be well below what she's been used to doing while she starts to recover. Part of that will be wearing the brace while she's walking, part of that will be decreasing her activity, and part of that will be actually getting off of her feet for some period of time. And then that leads us into the ice portion of the program, which is ice compression and elevation. With icing, we can do any number of techniques for icing. You can do an immersion bath where you just put ice and water in a bucket and immerse your foot for 7 to 10 minutes. And then you could use an ice cup, and we'll show you how to make one of those, which you could also use for 7 to 10 minutes, applying that directly to the skin. Or you can use a simple ice bag and just put ice in a baggie, and then we're going to go into the compression and elevation phase. For Jenna today, we're going to fit her with an active ankle volt. It's based on your shoe size, and you can find that on the website if you don't have a local vendor that has that. When we apply the brace, we don't apply it directly to the foot. You actually put it into the shoe and you slide it under the insole. On the outside of the brace it says outside of foot, so you cannot screw it up. And as we slide her foot in like a big shoehorn, first strap attaches in the back, and then the back straps. In this portion of her care, what we're doing is we're applying some compression. We're taking some pressure off of the ankle, so when she does start walking on it, it's going to be much more comfortable in the ankle. The very useful part of that in the rehab side of things is that we increase her circulation much more quickly. It allows her to weight bear and get the swelling pushed out of the ankle even better. Just by the normal ankle or by the normal muscle pumping action that occurs. So this is the protection phase, and she's going to wear this acutely while she's still hurting and while she's still swollen. But then she's also going to wear this back to practice and when she starts to play, and hopefully prevent that next injury. We told you could use an ice bath where you can just stick your foot in a bucket of ice water, but we're not getting the elevation or the compression with that technique. The other option is that you can make an ice cup, and you can just take a regular Dixie cup, put it in the freezer up to about 2/3 full, freeze it, and you come out with an ice cup. Then you just tear off the edges of the ice cup. And Jenna, I'm going to let you go ahead and do this. And you're just going to work in a circular motion and get the whole area where you're swollen and where you're painful. And you're going to do that for 7 to 10 minutes. The first 2 or 3 minutes aren't going to be a lot of fun. It's kind of painful until you start to go numb. Once the numbness starts to work and the pain control is taking effect, you're going to enjoy this, but use it for about 7 to 10 minutes. The most obvious way to take care of your swelling and your pain is to use a regular old ice bag. Go ahead and get some ice. Crushed ice would be best because it would conform to the ankle a little better. Put it in your normal sandwich baggie, zip it closed. You're going to apply that to the area. Again, the first couple of minutes aren't a lot of fun. Get you an A-strap of some sort, an elastic bandage, and we're going to put some compression now on this. So we've done the ice, now we're doing the compression. Go ahead and lift for me, Jenna. Now the last portion of phase 1 is the elevation portion. What we want to do is get this ankle above the level of her heart. So we're going to have Jenna lay down and we're going to put some pillows under her ankle. And having it hang down below actually lets the swelling pool in the ankle. So by having it at this height, it's going to help drain that back out of the distal portion of the end of the extremity back to the main part of the body where it can be moved out.